Yeah, we're live now. I'll share the link with you.
Janvi, can you share the link to our batch groups, or do you want me to share?
I'll share them. You start.
Okay. So once it is shared, 5 minutes, then we'll start. Okay. Janvi, do you know someone MGM? Because someone asked me and I can't find their contact. So, I mean, I need to share that link over there also. I'll just check if I can find. Okay, I found it. Is there a way like see how many viewers are watching this right now?
No one's watching right now.
No one's right. No, so let's wait for like some people to come start. Dimitris, did you share the?
I am sharing currently, but
Yeah.
the problem is that because it's weekend, most of the people will be having a late start, and they will most likely view the recorded version.
Yeah, later. Yeah, sure. So, should we start?
I'm good to go anytime.
Okay, Janvi. So let's start. I mean, whoever wants to join, they can join the mail. Okay. So, hello and welcome everyone to this free webinar on the path to specialty training in the UK NHS. I welcome Dr. Dimitrios Spinos, who is currently a trainee in East Midlands University Hospitals of Derby and Burton NHS Trust. So,
Morning.
Dr. Dimitrios, over to you.
Hello, good morning, good evening, everyone. My name is Dimitrios Spinos. I'm currently one of the core surgical trainees in East Midlands. I'm in an otolaryngology themed rotation. And today we will go through the process and the content of the curriculum of the core surgical training interviews. Starting, there are three main parts that we need to address. There is the clinical station, there is a management station, and there is a portfolio station. Small disclaimer, global pandemic and all the structure of the interviews has been changed this year. Their Health Education England is still publishing and updating how the process will be happening this year. I'm sticking to the traditional structure. At the end of the presentation, I can mention a little bit about what they plan to do this year, but I don't think that it would be beneficial unless you're applying this year, as it will probably revert to the traditional structure. So traditionally, you have 3 stations. Each one lasts for 10 minutes and contributes to 33% of the score. Most of the stations, clinical and management, have 2 parts that are quite distinct, and you even get a mark, a ring, a bell, something like that, that demarks when the second part starts while you're in the station. Portfolio station is just a single station, and it's all about discussing about your CV and what you've done so far. So regarding the clinical station, you get 2 scenarios. They're separate. There is no connection between these 2. And you usually get 1 trauma and 1 post-operative or a patient that needs urgent surgical intervention. Pretty much the curriculum concerns the ATLS, Advanced Trauma Life Support, and the CRISP, which is the care for the critically ill surgical patient. I would strongly recommend for all the participants to study the actual handbooks, because a lot of the information you will need lies in the protocols and lies in the management suggestion of all these algorithms. That being said, there are several interviews books that suggest specific scenarios. I cannot argue that whether that's beneficial or not. If you have done any surgical job, most of them will be familiar with you, because these concern common surgical emergencies, peritonitis, trauma, etc. If you, however, have done only medical jobs, it might be beneficial to have a quick sneak peek on what may be asked from you. There isn't much to add, apart from it's important to have a structured approach. The ABCD, as taught in these algorithms, is the absolute essential to make sure you're past the pass marks. But because most, if not all, the candidates will actually know about that, you need to plan ahead and know a little bit more about specific managements or pathways that you would like your patients to go through. Things that can give you points that may have not been as obvious are, if you were not aware of, are things like where you would like your patients to be sent, or you have called your registrar to operate, what would you do in the meantime? How will you organize to facilitate the process and things like that? I remember a simple question that was asked to me for my trauma patient was like, where would you like this patient to be treated? You want a trauma center, things like that, so that you have an understanding of the NHS structure and how the ladder would go regarding management. Moving on to the management station, that's a little bit more unusual for someone who is not in the UK. So you have 2 parts. The first part consists of a presentation of a known subject. Every year they announce the subject, but every year it's something about leadership. There is a very strong, one may argue even political movement within NHS about how doctors need to be leaders. And especially for surgery, they strongly encourage candidates to demonstrate how they have developed their leadership skills and how they can be trusted as future leader of NHS. So the first part is usually something like across the lines of, so was how throughout your career so far, what you've done has developed you as a leader or showed initiative or leadership. It will be a 3 minutes presentation. It's very, very important to match it with things that you have done. Do not give a generic pep talk because everyone will have prepared about this, and you need to try and make it as personal as possible. We are not baristas or lawyers, we're doctors, and it's important to speak with facts from our careers and not just to make it sound nice. Then you get 2 minutes with follow-up questions. These most of the times concern things that you have said. So you might mention something as an example. They might ask you why you think this. On this occasion, you demonstrated leadership values, or they might ask you some more generic question like, what's the difference between a leader and a manager, which are quite vanilla questions to be fair. And although all the interview preparatory handbooks teach about them, I'm not aware that they actually ask them anymore. The second part concerns management and leadership scenarios. So these can be anything between your consultant being drunk or your registrar using illicit drugs, and what would you do, how would you escalate, or you have a specific patient's concern about safety. What they look for is how you go through the ladder and to see that you understand the structure of NHS and who is your liaison and who is the next person of contact. But also, there can be some scenarios that concern capacity or consenting patients. These are, to my humble opinion, much more relevant to surgery, but there is equal chance that you can get either. So it might be something about a patient consented for an operation that are now confused. What would you do? Would you stop the operation? How would you assess? There might be a scenario about a patient with life-threatening problem that lack capacity. What sort of consent form do you need to fill in? And things like that, that again demonstrate an understanding of the structure, but also the actions you need to take. There are two very useful adjuncts. One is STAR, situation, task, action, result, which is very useful if they ask you to speak about an incident that you were involved and that you demonstrate X value. So talk about a teaching that you did that went wrong, or talk about an incident that you showed initiative, things like that. Whereas on the other hand, we have SPICE, another very useful adjunct, which is about situations that things have gone south, like near harm to a patient or harm to a patient, or the scenarios that I already talked about with the consultant being drunk, etc. So seek information, have they operated on someone or they just showed up for work, and so on. There is a limitless amount of questions they may ask you. In my interviews, they asked me about my foundation year one doctors having difficulty and needed support, how I would support them. So it's quite important to use a little bit the resources that GMC offers online. They are quite numerous, but it's very important to understand the structure and how you escalate concerns or how you support colleagues. These are two parts split as 5 and 5 minutes. So for the second part, you mainly do the talking, but they will have a lot of follow-up questions that will add to the scenario. Last, but definitely not least, is the portfolio station. This is probably the station that will take most of your time preparing, because by the time you arrive on your interviews, you almost always know about the right number of marks you'll get. So it's important to maximize how much you will be marked on. Every year they publish a different assessment form. So for that reason, I did not put grades and marks here, but I will give a general structure and idea of what's going on and how each separate section can be maximized. Starting with a primary degree and postgraduate degrees. To be honest, for primary degree, if you are not a student in specific colleges and universities inside the UK, you will not manage to get any marks because they're looking for specific UK sort of grades and diplomas. But you can maximize the postgraduate degrees. So if you have done a master's or a postgraduate, you can get some points. If you have done a PhD, you maximize your points, but by the time you apply for core surgical training, if you have done a PhD, that's a huge dedication. Well done for you. Moving on to the prizes. This includes prizes for best presentation, national or regional prizes for best trainee or youngest scientist, things like that. And it also includes high honors degree graduation marks. So if you manage to get a very good graduation mark or finish medical school as a very high percentile, it's quite important to get some documentation about that. Quality improvement. So this is a huge thing for NHS. It's one of the mandatory duties of a doctor according to GMC. They are looking for involvement in audit projects or quality improvement projects. You get marks for even getting involved as a secondary author or supportive member in an audit, but you need to try and maximize your points here. It usually offers a lot of points, 7 to 9, and most of the candidates will have tried to maximize this, so should you. You get points for having a full one single cycle audit, and then if you do a second cycle and close the loop, you get even more points. And then it offers more points for local or regional or national presentation of your audit. That being said, what offers you the maximum points changes every year. This year, I believe it would be regional. Historically has been national. So the more you try for it, the better for you, and the more certain you'll be for your outcomes. Teaching experience. Regarding teaching experience, again, it offers a lot of points because they want doctors to be hands-on regarding teaching, and they want people to support the medical education from inside the NHS. So if you have delivered teaching, you get points, but again, try to maximize your teaching experience. The maximum points you normally get them from organizing a teaching program and delivering teaching in it as well. This can sound a little bit intimidating, but you need to be a little bit smart about this. So if you have medical students in your hospital, organizing a series of bedside teaching, especially if it involves other colleagues who are also teaching them, and if there is a concrete structure, then this can actually be used as organized a series of teachings, teaching sessions, and deliver teaching as well, giving you the maximum points. Training and teaching is a different kind of beast altogether. Again, they in the same kind of mentality that they plan to encourage doctors to pick up the mantle on medical education. They are offering points for you if you have done any training on how to teach. Um, you get the maximum points if you have completed a master's in medical education. For core surgical training, because you normally are quite early in your career, that's not the case most of the times. And I would definitely not encourage someone to do that at this point of their career if they're into medical education. If you have completed a postgraduate degree or like a single year sort of modular diploma, you get some points, and you also get some points if you have completely completed some sort of either online modular teaching or seminars about how to teach. So there are a lot of like teaching the teachers, or for the different sort of ALS or ATLS. If you become our instructor, you have to go through an instructor course, and this can contribute to these points. Moving on to presentations, there are separate points for presentations of posters and presentation of giving a lecture. There is an overlap, so on some slots it tells you that if you have presented more than twice a poster or given an oral presentation, you get X marks. So you can go either way. Planning ahead for your next interviews as an ST, it would probably be best to get a healthy balance of both. Maximum points you get for an international presentation, and either two presentations of a poster in an international meeting. There is a lot of flexibility on how you can say that the meeting was international. So I've seen a lot of meetings inside the UK that are addressed for mainly UK candidates, but are deemed to be international because they have invited speakers from abroad, or they offer open applications for people from abroad. So if you pick carefully your battles with this, you can get an international presentation in a not so harsh way. That being said, local and regional presentations are much easier, especially if you have like regional teaching with a neighboring hospital. So this, anything you present can be used for this slot, and it's quite important to have some sort of letter from your supervisor stating that you did so. Publications, this is probably the hardest to achieve. You get the maximum points for being first author in two peer-reviewed journals. Unless you started something earlier as a medical student, it's unlikely that you can timely publish something during your foundation years, especially given that you have to do the rest of the list on top of your clinical duties. I wouldn't be bothered too much for publications unless you already have some, because the maximum points you get are 4 for being first authors in 2 journals. So in this kind of list of points, you try to maximize your points in a more time efficient way rather than try to get everything done. Leadership roles are pretty straightforward. You were your medical school council representative. You were your medical school rugby team rep, doctor's mess rep, and so on. There are different points regarding whether your role was local, regional, or national. national roles, to be fair, it's quite hard to achieve. And even the regionals might be tricky depending on how big your region is. But most of the times you can pick on a local role and use it. I used to be myself a vice president of a volunteer blood donation team in my university, and that offered me points. Moving on to the procedural experience. So this is a little bit tricky and flexible. What you need is not like a logbook or stating what you have done surgery-wise, but you need a letter from one of your supervisors stating, ideally with examples, of procedures, both surgical and non-surgicals, that you have demonstrated during your F2 or whichever F3 or whenever you apply for CST, and that so that you are above and beyond the rest of the candidates. This is by no means, this is probably the most flexible slot, and it really depends on what your relationship with your supervisor is and what their impression on your work is. So if they're happy to provide a letter stating that, you get points. You get up to 3 points. If you are above and beyond or extremely advanced compared to the rest of your cohort, I would say try to do that. When I applied for CST, I consider myself to be slightly above my peers, but nothing exceptional. I found out that most of the candidates try to state that they're above and beyond, even if that was not the case. So try and find someone with whom you have worked with. Try and demonstrate your dedication. Try to get on your hands on some procedures and get them to sign you for your contribution for that. Last but definitely not least, the commitment to surgery and specialty section of the portfolio. So this is probably the biggest section. It contributes up to 12 points. So there are a lot of different pathways to fill these points in. And every year they might even add some points in this section. So undertaking a surgical audit or research project would give you points. That being said, if you have only done one audit, and that's a surgical audit, if you use it in this section, you cannot use it in the audit section and vice versa. So you would need at least 2 audits to maximize your points, and one of them being a full cycle. Craft courses, these are like the surgical workshops. They might be generic surgical, like basic surgical skills, or they might be more specialty oriented. For ENT, they're like temporal bone dissection courses. For orthopedics, there are ligaments suturing or cadaveric courses for anatomy. These they accept an X number of courses every year, and each course gives you 1 or 2 points. This depends every year. So a healthy balance would be 3 to 4 courses. They normally don't offer more points for more courses than 4. A surgical elective, so that's a tricky one because you should have done it before graduating, most likely. Because once you start working, it's kind of hard to take time off for an elective, but it also gives you points. A surgical taster week. So this is just to clarify for people not in the UK, this is a very F1 oriented task. You get 7 days of study leave to participate in different department, regardless of where you were initially placed. And if you pick that to be in a surgical department and write in your portfolio reflection of what you learn and how this change your perspective or how this encourage you to pick up on surgery, that would be contributing points for the interview. E-logbook is the way that we document our operations here, and you can enroll. It's free of charge. One of the few things that's free of charge. It needs, I believe, the GMC number. We log in with our GMC number. If you are in the UK, I would encourage you to use it with a GMC number. You can still log in the e-logbook without being registered to GMC. But what has happened with some of my colleagues that I'm aware of is that they logged in the register while they were still medical students or abroad. Then they moved to the UK, and there was a discrepancy between their account that they used to have and the new account that were given with their GMC number, and that can contribute to a lot of bureaucratic trouble. So what you want is ideally create a logbook and log in some operations. It doesn't matter how many you log in. So if you say do a taster week and open your logbook at that point and log in the operations you attended or assisted in, that would be fantastic. You get full points for both. There is no part that gives you different number of points regarding what kind of operations you've done or how many operations you've done. So MRCS part 1, that's also a tricky horse. This year, they actually offered more points if you have successfully passed it. Last year, they were offering points by just trying and sitting it. So there is a sitting in January, which was right before the core surgical training interviews. If you had paid for that and sat through the test, you were getting the points, regardless of the outcome, which was actually being published almost a month after the interviews themselves. If you plan to study for MRCS, I would consider it being a wise plan, but it needs a lot of time. So probably during your foundation year 1, if you are sitting through the interviews during foundation year 2 or F2 for F3, you will need to dedicate at least a healthy 4 to 5 months revising on top of your clinical duties and progressing through your portfolio. Last but not least, membership of surgical societies. This is like a very easy point to get. By paying £15, you can become affiliated member of Royal College of Surgeons. This is literally a pay-to-win point, so just do it. If you have other surgical societies that you're part of, it's fine. You can use them. But in case you're wondering, how can I become a member of a surgical society? Royal College of Surgeons affiliate membership doesn't require anything from you apart from be willing to become a member. Finally, on the day of all these questions so far of the portfolio were also part of your self-assessment, which you will upload during your application. But there's a last hidden sort of agenda and point for the organization of your portfolio. So it literally concerns how your portfolio looks and how it's structured. And you can get up to 3 points on that day. I got maximum points on this, and I just used like a regular folio with very well organized sections. But you will see some incredible things on that day. There are people coming with leather-bound folios with their initials sort of printed on it and so on. Don't be intimidated. It's not about the appearance. It's about how easy it is to navigate through. So it would be best to start planning at least 2 months before the actual interviews on how you will structure it so that's easy for them to browse through it. So that was it regarding the structure so far of the core surgical training interviews. As we discussed, there are three main sections: the management section, the clinical section, and the portfolio section. I would like to close this presentation by saying that coronavirus pandemic has changed things a lot. And for this year, and I don't know for how long this will be going on, things will be different. This year, the candidates will have a single station of 30 minutes that will check their management and clinical knowledge. And they will be asked to upload a self-assessment regarding how much they would score themselves on the portfolio. And if they are offered the interview, then they will need to scan and upload all the evidence. Obviously, I cannot predict how long this will be in effect and whether or when it will change. Health Education England updates regularly on that. And on top of that, you can find more information on Oriel platform. One last thing to say before closing is that myself, I'm from abroad. I was not trained in the UK, so most of the evidence was not from the UK. This should never dissuade you from trying and uploading it and using it. It's important to get it translated though, officially. And it's also important once you move to the UK to try and demonstrate a continuation of your effort. So I had several craft courses in Greece, but I also had a couple in the UK, so that I was not just lenient, but I was continuing trying to improve my skills, and no one challenged me about giving them or offering them presentations I've done abroad. And because there is a lot of misinformation about that, please make sure you translate everything and use it. Thank you very much for your attention and your time. And if anyone has any questions, I would like to address them.
I have a small question, Dimitrios. You talked about surgical electives a few minutes ago. So I was just wondering, we go for these surgical electives as graduate, like undergraduate medical students? Is there a specific way you go through for international medical graduates?
So to be fair, if you are so for the electives, just a small disclaimer to start, you can also use an observership that you have done as a graduate on that slot. But if you're talking about strictly electives, in that case, you need, unfortunately, to try and contact each hospital or its consultant separately. Some of the biggest universities like Cambridge or Imperial or King's have their own online platforms that you apply. At the moment, with Dr. Kadam, we're trying to organize a pathway that we can facilitate this process. But obviously the COVID-19 pandemic has made it really hard for these plans to proceed within 2020. We hope by 2021, we will manage to offer a facilitated version for it. And for the time being, unfortunately, you have to organize well ahead of time, contact the universities, apply for visa, speak with the consultants, get them to accept you, and then attend, which is, I appreciate, very, very tricky.
Okay, thank you so much.
Thank you so much, Dr. Dimitri, for taking us through the insights of surgical specialty training in the UK NHS, sharing your invaluable time and imparting knowledge to us. We, the Student Council of DYPSOM School of Medicine, are grateful to you for collaborating on the event MedUK. All the best for your future endeavors. And thank you so much for watching, everyone. Looking forward to hosting all of you for many such events in the future. Please like, share, and subscribe to our channel. Thank you so much. This is the Student Council signing off.
Thank you. Thank you. Thank you.